If your legs feel weaker or more tired than they used to, it's probably not just your age. There's a hidden reason that people over 50 feel that their legs get weaker over time, and the good news is it's fixable. 4 reasons why your legs get weaker after 50 and give you an exercise to fix each one. Weakness in the legs can be caused by 4 things. The first is sarcopenia, or muscle loss with age. After the age of 50, we lose muscle mass at a rate of about 8% per decade, and this loss of muscle mass can lead to weakness over time. The second reason for this weakness in the legs is disconnection to our target muscles. Now, we've got neural networks in our body, which are basically networks of nerves that connect your brain to your muscles. And it isn't just your muscles that can get weak over time. You can actually experience weakness in the signals that travel up and down these networks. Less signals from the brain to the muscles means you can't activate those muscles as well, and that can lead to weakness in the legs. The third thing that can cause a loss of strength in the legs is a reduction in joint mobility. As we get older, if we lose mobility in a joint like our knee, either due to arthritis or disuse, that stiffness can quickly lead to a loss of strength. The fourth reason for a loss of strength in your legs is poor balance. Now, if you don't have a stable leg to push off from, you can't generate proper force. So losing balance is a surefire way to lose strength as well. So I'm going to show you an exercise to fix each one of those 4 problems now. But before I do, I just need to make you aware that these exercises are not going to be suitable for everyone, and definitely avoid them if they cause you pain. The first thing we need to fix is that muscle loss with age. And I can't think of a better exercise to show you today than a variation of the squat. So I'm going to show you a couple of variations just so you can find your own starting point in this. Pick the one that you find doable but challenging, then as you get better, you can progress. So the most basic variation of the squat is the sit to stand. So you start off sitting on a chair, shuffle right to the edge of the chair, take your hands out the way, and then you go nose over toes forward and up, and then put the movement into reverse. Stick your bottom out, bend your knees, and 4 seconds on the way down. It's got to be as slow as possible coming down, because that slow downward phase is really stimulative for rebuilding both strength and muscle. Now, if you can do more than 10 of these with absolutely no problem and you don't feel any achiness in your legs at all, then you need to make it a bit harder. And you can do that by turning it into a goblet sit to stand. Find a small weight, hold it to your chest like this, and repeat. Keep your back up tall, forward and up like that, and then slowly into reverse. And you've just added a few kilograms or a few pounds to your body weight to make that movement more difficult. Now, as you get stronger, you can get rid of the chair and you can repeat the goblet squat with no support behind you. So if I move that to there, take your weight like this, and then you squat down as far as you can go, and then come back up. And if you're finding this really easy, you might need to find a squat rack where you can actually put a barbell on your back and then repeat the squats. You might need some more equipment for that. But find one of those variations that you can do while it's still challenging. Do 3 sets of somewhere between 10 and 20 repetitions, and then we can move on to the next exercise. Second exercise we're going to do is one that improves your connection between your mind and your muscles. And if you don't have that connection, your knees are going to feel weak. Your legs are going to feel like they're going to give way. It's just not pleasant. But this exercise fixes so many of those issues. It's so easy to do. It's called the inner range quads. And all you need for it is somewhere to sit up like this and a pillow. So what we're going to do is fold your pillow in half like this and tuck it underneath the knee that you're going to work. So you've got maybe a 20-degree bend in your knee. The exercise is very easy. We're just going to push that knee down into the pillow, lift your foot up like this, pull your toes up towards you, and feel that muscle contract. Now, you can do this exercise one of 2 ways. The first way is you just do it without thinking about it, and like most people do, they're just doing it while watching TV. Look, not much is happening if you do it like that. The second way you can do it, which is the effective way, is push down and lift up and focus all your attention into that muscle. You really want to feel it contract, as if you're trying to activate all of those muscle fibers. Literally visualize them all switching on, lighting up like a Christmas tree, and feel that muscle tense. You can even put your hand there to get some feedback. A nice 5-second hold while you're doing that is brilliant. And you will start to feel your quad getting a bit achy. That's totally normal and actually exactly what we want. And after you've done 15 or 20 of these, swap sides and do the other side. Do this little and often. Do it in the morning, do it again at lunchtime, and do it once more before bed. And I promise in a few weeks, your legs are going to feel so much stronger no matter your starting point. The third problem we want to solve is that loss of mobility in your hips and your knees. If we don't have mobility, we can't use the muscles that we've got, even if we've got healthy muscles there. And this little exercise helps you regain some of that mobility. It's dead easy to do. Just lie on your back on your bed or a mat on the floor like this. You want this knee just to be resting, so this one can just stay there, and the other one is going to be the one that's working. First thing we're going to do, push your leg down into the bed, so we've got a full extension of the knee, and then we're going to put it into reverse. Bend the knee, pull up towards you like this. When we get to the top, have a squeeze, then bring the knee up, and at the top, use your hands to hug in and then put it into reverse. Drop the leg down, straighten out, and push the knee down. Simple as that. So push down, bend, 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 come as far as you can, so you're bending your knee, then lift the hip, and then use your hands just to hug in and relax back down. It's such a simple routine, but what we're doing here is we're maximizing knee extension, which is when the knee is flat. Then when we bring this up, we're maximizing knee flexion, which is when the knee is bent. Then we're moving into hip flexion, and we're maximizing that using our hands. We don't want to go to the point where it hurts. Definitely avoid ranges that cause you pain, but pushing into a little bit of stiffness is okay, as long as it doesn't make your knee sore or your hip sore or give you that pinching feeling. If it's just stiffness and it feels a bit stiff at the time, but then it's fine when you let go, that's usually a really good sign. It means you're doing something that your body is really agreeing with. It likes it. It wants movement. Your body does not like being stiff. And if you keep it mobile, it will thank you for it. Somewhere between 10 or 20 of those in a row on each leg, a couple of times a day, makes a massive difference to your mobility, which will in turn improve your strength. The fourth and final problem we need to fix is that loss of balance. And the best exercise for most people to do is the tightrope walk. Now, I love the tightrope walk because it doesn't just challenge your static balance, like standing on one leg, it challenges your dynamic balance, which is much more functional for daily life. So here's how the exercise looks. All you need is a clear runway at home, and you're going to imagine that you've got a tightrope on the floor like this. It makes sense, by the way, to do this next to something you can grab hold of just in case you lose your balance. So here's how it looks. You're going to stand with a nice narrow base of support, and then you're going to step heel to toe as if you're walking along a tightrope. So the front heel touches the back toes and you keep progressing forward like this. Now, the beauty of this exercise is it makes you so narrow. You've got such a narrow base of support that you are going to be wobbling. It's almost like going onto a bike. And the slower you do this, the harder it is. It's very easy to do this fast, but counterintuitively, if you slow this down, that challenges your balance much more. So I would encourage you to do this as slowly as you possibly can. And don't worry if you start wobbling, that's totally normal. It's actually a good thing, because wobbles just mean that you're challenging your balance enough to improve eventually. So practice that for about 1 minute at a time. Do it a couple of times per day. Little and often works best for balance exercises. And you've just done a full workout to strengthen your legs and reverse that weakness that comes over time. If